Welcome to Elevate with Erica, Conversations Around Wellness. This series is designed to educate massage therapists, caretakers, and anyone interested in health and wellness, especially as it relates to massage. Every episode is a chance for you to not only learn, but to also take care of yourself. Self-care is at the heart of what we do here, and today's episode is all about hydration, something our guest is a huge advocate for. So, grab your water, settle in, and let's take this time to nurture both our minds and our bodies. I'm honored to introduce today's guest, Dr. Kimberly Johnson Hatchett. Dr. Hatchett is a board-certified neurologist, healthcare leader, patient advocate, associate professor, and so much more. But above all, she's a wife and mother of two amazing girls. Dr. Hatchett is passionate about helping others understand their bodies, especially the brain, and showing us that so much of what we need to live a healthy, amazing life is already inside of us. I can't wait to dive into this conversation and share her wisdom with you. Let's elevate together. Hello, Dr. Hatchett. How are you today?
I'm doing good. How are you?
Good. Thank you so much for joining me. I have a few clients with memory loss disorders. And as a massage therapist, it is incredibly rewarding to work with them. And I want to, spread the word about it and maybe shed a little light on the subject for people who are not familiar. So, first question is, can you explain how Alzheimer's, dementia, and other memory loss disorders physically affect the brain and body over time?
Yeah. So I guess when I talk to my patients, I kind of describe to them the old adage, once an adult and twice a child. Have you heard that before?
I have not, but I totally get it.
Yeah. So when you think about patients who have Alzheimer's disease, they start to regress, and eventually, what actually is causes them to pass away from Alzheimer's is that they actually forget to eat. They have to have everything done for them. So it's kind of like the movie The Curious Case of Benjamin Buttons, and the way that he aged backwards, but all of the things that he had to do as a old man, but he was this infant or toddler and he was using a walker. He was forgetting how to eat. All those things is what happens when someone has Alzheimer's dementia, or different types of dementia, but really Alzheimer's dementia. It was just a very poignant movie that highlighted all of the things that happened to people, and that regression, and how the agitation that he had when he was a teenager, and jumping on the roof and doing all the stuff. That's the where those patients get agitated at night and have the things where they think someone's after them, or they think that they don't trust their loved ones, or all those, that paranoia that they can sometimes get. That's what he showed when he was like a teenager in that movie. And then as he aged and got younger and younger and younger, you started to see it. And I remember watching that and just thinking, wow, this is really a good example. And I use that movie for not the patient, but the patient's spouse. I'll say, I want you to watch that movie, and that'll give you an idea of what you're going to be facing. And I mean, there's medications out there now. We know so much more about the disease and how to prevent it and how to slow it down. But really, when I think about Alzheimer's dementia, that's the movie that I go to, and that's the description I give to my patients.
It is I never thought about it. I've always said it's the circle of life, where we begin, so we end, I had, I have family members who have had dementia and work with people who are Alzheimer dementia. And that is exactly right. And I love that you tell the caretakers that too, because sometimes I joke with my husband, because dementia runs in my family, to study up on The Notebook, because it's about a man trying to reach out and reconnect with his wife who has dementia.
Mm-hmm.
It's like a little joke that we like, dark humor, like go watch
Yeah.
the movie, make sure you study up on it. But
Yeah.
Benjamin Button is a great example, and I never thought about it. I never
Yeah.
made the connection. What a great example.
So
Yeah, incredible. Well, that's something I can tell my clients too.
yeah.
You see when caregivers are confused or worried or upset, um, it is nice to have something to look at and
Mm-hmm.
identify with a little bit.
Yeah, definitely. Definitely.
What are some common physical symptoms or challenges that people with memory loss disorders experience?
Um, I think some of the physical challenges people don't think about, like the incoordination, the things that we take for granted that are more executive types of functions where we have always, it's kind of like a good example is when you're driving to a common place or like driving to work. If you really sit and think about it, you're not thinking about where you're driving. Your body's on automatic. You're automatically turning the wheel and doing the things, and you get there. And I remember the first time that happened to me when I first started working in out of college, and I got to work and had no recollection of my drive to work. But it's because I went into automatic and was laying down memories about other things, but I wasn't really having to think about how I got someplace. So those types of physical things are what people with Alzheimer's dementia or with dementia start to have to really like when they say they can't make it home, that's a big deal because that's a foundational memory for most people. It's one of those things that you don't really have to think about. It's kind of like riding a bike. You don't have to really think about it. Your body has made that mind body connection on how to coordinate to do that activity. So, those types of physical things are the things that I really start to hone in on because they are very deep seated memories that you should be able to hold on to no matter what your age is. Um, when I think about physical things, though, I think that we as an aging population don't push our aging population to really move as much as we should. And when people say I'm retired, it's like, okay, I'm retired and I can sit down and rest. And that's probably the worst thing that they could do is sit down and not move as much as they were when they were working. And that can increase the risk of arthritis, that can increase their risk of falls. And then if you fall, you can have increased risk of things like hip fractures. And, 1 in 4 people who fracture their hip after a year are usually did. So that is something that is a big deal when someone fractures their hip. So dementia can affect coordination in a way that is almost cruel because those things that they used to be able to do, they're no longer able to do them. Those complex movements, like dancing, or complex movements like martial arts. If they were really into those things, they would lose those things. And so that's why I think that pushing or encouraging older adults to take up even things like dancing, martial arts, Tai Chi is really good for their brain, not just for their bodies and their muscle strength, but it's good for their cognition as well because they're creating those new pathways by learning something new.
What do you think about swimming?
Oh, so swimming is one of those things that if you can do it, man, it's a workout, it's a cardiovascular workout that is so efficient. And it's almost like rowing. Swimming's kind of like rowing. It's so efficient because it's using all those muscles at the same time. It's using your core, it's using your arms, it's using your legs, and it's one of those things. And you're building your heart rate up. It's a really good exercise. And like I said, it's efficient, like rowing's efficient.
Rowing's a good one.
Yeah.
I love it when my older clients have access to a pool because
Mm-hmm.
that's number one recommendation that I make is like, man, get in that pool and start moving. It's zero pressure on your joints.
Yeah. Yeah.
It's fantastic exercise. It takes coordination.
Mm-hmm.
It's really good for them. But rowing is great for people. You're more, likely to have access to a rowing machine than you are a pool, probably. So rowing's a good one. So I'll keep that one on my list. Thank you. That's great. Are there any specific misconceptions or myths about memory loss disorders that you encounter or want to clear up?
I think that one of the misconceptions is that it is something that's inevitable as we age. And I think that that's a big deal. Like this is not normal aging. Having dementia is not something that you can say is inevitable. And there's things that you can do to decrease the risk of actually having it happen to you. The stars that are in the media with the certain types of dementia that they have are very rare, and they are kind of like a rhyme or reason of why they got it, like Bruce Willis or oh, I forgot the woman's name who is the talk show host, Wendy Williams.
Mhm.
Yeah, yeah.
So
Um,
sad.
so their type of dementia is rare. It's very, low frequency. Alzheimer's dementia, vascular dementia, those two types are the more common. But they're not inevitable. And what's so crazy is people think of dementia, it's not crazy, but it's becoming more and more prevalent to understand that that Alzheimer's dementia is known in some countries as type 3 diabetes. And it
Wow.
is looking at as from a sugar and glucose and insulin standpoint, that is a endpoint as well, and that is a mechanism of diabetes as well. So that's something else that I've started to do some research on, because like I said, in a lot of circles, that's what Alzheimer's dementia is called, is type 3 diabetes.
Wow. Well, I will stay tuned on that if you're going to be sharing that on your Instagram, because that is very interesting. I have a continuous glucose monitor for a program, like a fitness program that I'm in,
Yeah, yeah.
and I wear it every once in a while. And I think everybody should have access to one. It is so insightful about how your body reacts to calories and types of calories,
Mm-hmm. Mm-hmm.
But I will say my body gets inflamed with sugar, like refined sugar.
Yeah.
Um, and I could be cloudy in the head a little bit. I could
Mm-hmm.
totally see that. So that's really interesting that they call it type 3 diabetes. Wow, that's super insightful. That's so cool.
Well, I
Interesting.
mean, when you think about the amount of food that we eat that is full of sugar and the amount of sugar that is in our diets, it's just it's almost I don't know. It's one of those things that you have to really be mindful. Like when I say be mindful, you have to almost be vigilant when you're looking at the amount of sugar and amount of food and refined sugar. Like that, like you said, the refined sugar is the issue that's coming after us. My kids want to have donuts every Sunday, and I'm like, really? Donuts? So it's like, man, I like a good donut, but man, we have got to be very like one and then be done for a month. So it's so it's one of those things that you can quickly get disheartened, but you have to. I look at it like we have so many things in our control, and we can control that. Like we can control what we put into our mouth. We really, if we really sit down and think about it, like some people have the voices, and what I mean by the voices is that they feel like the food is really calling to them, and those medications that people take, those GLP-1 inhibitors, are definitely quieting the voices and helping those people. But you have to recognize whatever weakness you have towards food or whatever issue you have towards food, recognize it and work on it so that you can be in control of it.
Totally. Yeah. And speaking of being mindful, we're going to be heading into another topic, but let's hydrate.
Okay.
Dr. Kim's always preaching the hydration, and I have to tell you, I have started hydrating. I keep my bottle right next to my bed, and everybody's like, "Oh, you're gonna get up and have to go to the bathroom all night," and I'm like, "I'm getting up to go to the bathroom all night anyway, so I might as well take a couple sips of water when I get up.
Yeah.
I'm gonna go anyway." So
That's what I was thought it was so funny. People are like, well, then I'll have to go to the bathroom. And I thought, let's stop and think about this. Don't you already get up and go to the bathroom? The
yeah,
vast majority of
it's
us do.
such a weird, irrational thought about it, but I totally had it too. I was like, "Well, but wait, yeah, no, I do get up anyway, so who cares?" Let's talk about massage benefits for clients with memory loss. What physical and emotional challenges do caregivers or family members of people with memory loss disorders often share with you?
Um, the the stress is what I think a lot of people don't even realize that they're dealing with. The stress and when those people who are going through the dementia have the realization, like they'll come to themselves for a moment and have the realization of what they're putting their loved one through, that creates a lot of stress within that individual. But then the stress that the caregiver has, they mask it really well. But I've had to stop caregivers and say, are you getting the mammograms? Are you getting all the things that you need to get done to take care of yourself? Because I have seen it so many times where that person ends up getting sick, they end up dying, and they leave the person who has dementia behind. And that is something that you just don't want to have happen. But that stress, I think, that goes along with that disease is something that's very underlooked at. Like they did the level of stress that puts on to the individual and the caregivers is I think underreported.
Sure. And you can't pour from an empty cup.
Right.
It's true.
Right.
You'll wear yourself right into the ground. So, yeah. From your perspective, how can massage therapy complement medical care for patients with Alzheimer's, dementia, memory loss disorders?
So I think from a massage standpoint, first of all, it is one of those things where it improves people's circulation. It improves their mind body connection because you're being asked to relax parts of your body that most people don't even don't realize how much built up stress is in certain areas of their body. And so being able to relax that and really relax your mind and get your mind in a good space, that is something that I think massage therapy can definitely benefit. And I think that people are using massage therapy more and more with chronic disease, and more to bring that mind body connection back together. And in a way that's not exercise, that's not, strength training or things like that, but is in a more relaxing and safe environment. And when I say safe, I mean more of a environment that doesn't require them to do really anything. It's just requiring them to be present, and helping them focus and keeping their mind focused on one thing. So I think that's to me what massage therapy could do for those who have dementia. Um, so
Great. Are there any particular physical symptoms, like restlessness, tension, where massage therapy might benefit or provide relief?
Well, when you say tension, the big thing that, as a neurologist, I think about is the tension that people have in this area of their body. So, like people have tension headaches, but people carry that tension, that stress in their shoulders, in their neck, in their head, that area back behind their um capitis area, that all that area back there is where a lot of people carry their stress and carry their tension. Even with joints, because some people with dementia aren't moving as much, passively moving their joints while you're doing the massage is helpful, because you're helping them stretch. You're helping them decrease by stretching. You're helping them decrease their risk of falls because they're being stretched. They're warming those muscles up. They're being allowed to, like I said, passively move. So I think that's where um massage therapy could be very helpful for patients who have dementia.
What advice would you give caregivers looking to incorporate massage therapy into their loved one's self-care routine?
I would say definitely don't just do it for the don't just do it for the person, but look at it as a holistic thing that you can do for them. Like it would not just be just for one person. That this could be beneficial not just for the person with dementia, but for the caregiver. And that this is something that is not a luxury. It's not a luxury. It's something that is needed, and can be used in a way that could really enhance, um, I mean, this to me, the mind body connection can't be beat. So that's the thing that I would say is that don't look at it as a luxury. Look at it as something that, and a lot of insurance companies are actually paying for it, by the way. So, really tap into your Medicare benefits and make sure that you understand that this can be used from a medicinal standpoint.
Yes, and massage therapists go out there and get your NPI numbers so that your clients can use their receipts to get reimbursed for their
There you
massage.
go. There you go.
So, just a little tip. Are there specific times during the progression of these diseases when massage might be like especially beneficial?
Um, I think there's sometimes it depends, because if that person has anxiety or has a mistrust as part of their um, disease process, it might be hard for them to allow someone that they don't know to touch them, and they might not want to be touched. So, the building that relationship up early could be very beneficial, just because they'll continue to allow that to happen. I think later on in disease, being able to uh, console the person, because you're almost like, and I think go back to that movie where she would stroke him and hold him and take care of him because he was a baby. But that type of holding can really be very beneficial from a comfort standpoint. Because we don't know what they're thinking, we don't know what's going on, but we know that they're there, and you want to calm that person, their inner fears, their inner thoughts. You want to get them in a space that allows them to relax. So I think, throughout the process, but specifically, if you think about it from a advanced standpoint, that is when the person needs touch the most. They need to be held the most. They need to be have their hand held. They need to be stroked the most, because they're in the stage where they're almost dependent upon everything for that from someone else.
And they're not moving like
Hmm.
they used to.
Yeah,
And their bodies get so sore from just,
from stiffness.
yeah,
Yeah, from just not moving.
yeah, yeah. How can caregivers assess whether their loved one is a good candidate for massage? Or is there something that they should discuss with their healthcare professional before pursuing it?
I think they should discuss it. Like they should discuss, what are some other therapies that they could use to improve the health and the just improve the health of their loved one, and ask specifically about massage therapy, and find out if that's something that, based on their health needs and their other comorbidities, that they might benefit from. So specifically, if they have bad arthritis, if they have joint disease, or if they have neuropathy, all those things that need to come into play when you're thinking about massage therapy and the benefits of it. Because of the increased circulation that happens with massage therapy, that might be something that they might benefit from, not just from a dementia standpoint, but from, if they have peripheral vascular disease, if they have all of those different things need to be considered, as possibly, okay, they might not have bad dementia, or their dementia might be early, but they have all these other things that massage therapy could benefit from.
Mm-hmm. Yeah, absolutely. Um, so we talked about like some of the concerns, but are there any contraindications maybe that massage therapists should be aware of?
From a uh, when I mentioned neuropathy, some patients might have neuralgia versus neuropathy. So if they have neuralgia, meaning they might have had shingles, and it might be a very painful part of their torso or their leg or their arm or God forbid their face, but but in their arm, wherever the shingles showed back up, they might have a neuralgia in that area, and not need to be touched because that's so painful. So it depends on that would be one contraindication in my mind if they have a post herpetic or post shingles neuralgia that has developed after having shingles. If they have, any type of skin sensitivity like psoriatic arthritis or psoriasis, if it's hurting them, like if their skin actually hurts to touch, that probably wouldn't be a good thing for them
Yeah,
to
you
do.
don't want to do it during a flare.
Right,
Yeah.
exactly. And if they're having a flare and they can't get it under control, then I would say that would probably be a contraindication.
Yeah, totally agree. I do have clients with psoriatic arthritis, and massage does help
The
almost
arthritis. Yeah.
like prevent or avoid the flare-ups because
Mhm.
it's able to
Mhm.
get into that, you know,
Mhm. Mhm.
parasympathetic nervous
Mhm.
rest and digest every once in a while, like on a
Yes.
regular basis.
Yes.
And I do feel like that really helps
Decrease the
things
flares.
off. Yeah, maybe they're not as bad,
Mhm.
or they're
Mhm.
few and far between. So, but I do agree when they have a flare up, you could forget it. You ain't touching them. What should massage therapists understand about like the limitations and unique needs of memory loss disorder clients?
I think making sure that their space is very calming and can be almost routine, and that reassurance, like having that level of reassurance, it's going to be okay. Like if they get nervous or they might ask the same question over and over and over again, and being patient. Having patience, I think, is something that I would tell other therapists that they need to have is have patience, and that this person might need redirection, and they might need that what you want them to do, told to them a few times, and it's okay. So that would be the big thing. Is just have an abundance of patience, and just
That
keep
one.
your environment calm.
Yes. Um, I would say you're going to repeat yourself a lot. Answer every question like it's the first time,
Mhm, mhm.
and buckle up because they love to say fun things. And
Yes, yes.
I've had some real chuckles with my clients. They just absolutely make me laugh. They're hysterical. Um, how do you, what do you think the best way is for massage therapists to collaborate with healthcare professionals or caregivers to provide the best care for the client?
Well, and I think a multidisciplinary approach. So, getting with groups, being able to be part of a like they have memory centers, they have neurology group centers, they have different centers, that those centers are multidisciplinary groups. They just don't have a neurologist or a geriatrics doctor. They have a social worker, they have care coordinators, they have physical therapists, they have occupational therapists, and then being part of that team, like you said, get your MPI number. That's what I would say, is that, integrating that part, be show value. Like you have to get out and show value, because you do have a value to bring, and recognizing that and getting with those groups that are already utilize a multidisciplinary approach with physical therapy, occupational therapy, um I know in my practice, we send people for acupuncture a lot because it helps not only with their migraines, but with their arthritis and just with their overall well-being. So that's something that I think utilizing multidisciplines is where you would fit in the best.
Yeah, I agree. I love being part of my client's healthcare team. That's what, I'm part of many teams
Mm-hmm,
with
mm-hmm.
my clients, and um, linking up, sharing information, um, obviously with the client's approval. But it's invaluable,
Yeah.
especially PT and like trainers. Uh,
Yes. Yes.
we often discuss, how we can, team up and help our clients. So, do you think there's enough awareness in the medical field about the potential for the benefits of massage with patients of memory loss disorders?
I think that it's not very well not talked about a lot. And I think that what would need to happen would be studies. They would have to actually have some type of data to teeth to go after. So I know that it's available, and I know that we send some of our patients for massage therapy, but understanding the data and the benefits of it would be the biggest thing. So like delving into studies, delving into the evidence of why it would help patients with dementia, I think would bring it to the forefront, kind of like how alcohol and cancer, like that has been out for years. And for whatever reason, the Surgeon General decided to this year in January, and dry January, to talk about it. And I'm like, that's been out for years, like a long time. We've known that for a long time, to the point that I know a lot of us stopped drinking years ago. So understanding why massage therapy would be really important for patients with dementia or a part of their care, I think studies would need to happen, and it might take a while for it to catch on. But getting it out there more and more and more with evidence is the way to go.
What would you say to encourage more massage therapists to consider working with these types of patients?
I think to be open and to really understand that this is a clientele that could really benefit from their expertise. And to not just don't be afraid of putting yourself out there as a caregiver, not a caregiver, but a clinician. You are actually providing care for these patients and therapy for these patients in a way that no one else can. So the uniqueness of what they do is something that a physical therapist can't do, an occupational therapist can't do. I can't do it. So the skill set that they have, they need to recognize that they do have a skill set, and that the benefits that they would have for those patients is real, and be able to articulate that in a way that is very easily understood. So I think that that is what I would tell therapists, those massage therapists who are interested in this, being able to really articulate the skill set that they bring to the table that no one else can bring.
Yeah. And to come back to earlier when you said about the caregivers, it gives them a break. And,
Mm-hmm.
and when we're talking about a spousal caregiver, the hour that I spend with my client is an hour of peace for that caregiver.
Yeah,
It is
definitely.
desperately needed in some cases. So it's like this hugely rewarding thing
Yeah.
to work with these clients, and I'm so happy that you joined me today. I reached out to you on a whim. I love your content, and I'm so happy that you accepted my interview request. Thank you so much, Dr. Hatchett. Do you have anything else to leave us with? Where can we
Well,
follow you?
I am pretty active on Instagram and TikTok under Dr. Kim NeuroDoc. You can also find me on drkimberlyjhatchett.com, and you can subscribe to my newsletter called The Bluff, which stands for The Bottom Line Upfront with Dr. Kim. So you can sign up there on my website for that.
Oh, I'm definitely going to have to do that. Thank you so much, Dr. Kim. I'll see you on Instagram.
All right. Bye-bye.
Bye.
Thank you so much for watching this episode of Elevate with Erica.
Conversations Around Wellness. I truly appreciate you taking the time to join me on this journey of learning and self-care. If you enjoyed this episode, don't forget to give it a thumbs up, leave a comment, and let me know your thoughts. I'd love to hear from you. And be sure to hit that subscribe button so you don't miss future episodes. You can also connect with me on any of my other socials where I share even more content about wellness, massage, and self-care. Thanks again for being here, and until next time, take care of yourself and keep elevating.